Good morning, interns. Have I got something exciting planned for you guys today? Today is Patient Care Day. Woo! Yes, I'm very excited about today. I set this up a few years ago, and shall I say it's got great results. So naturally, the board wanted me to do this again with this group of interns. I can't wait for the results. I'm so excited. So over the past few weeks, the hospital has noticed a decline in the rapport built within our wards. So, in order to avoid this legal mumbo-jumbo crap, we really need to get back to our roots. Right, so go out guys and connect with your patients on that emotional level. Not because they're telling you to, but because you know that it's right.
Okay, so this is Miss Candy, who came into hospital yesterday evening at around 8 with a slight headache and loss of appetite.
Sorry I'm late guys, I just had a really late night. I was on chatting up this really hot chick. Turned out she was fat. Oh. But yeah, I don't know, I had the worst nightmares all night. I was being chased around by the cast of Hairspray.
Mr. BJ Bloomer-Race.
Hey, there's no need for name calling, call me Big Al.
Well, if you're ready, Big Al, you can start by running diagnostics on Miss Candy here. Alright, the rest of you guys, just follow me.
Hey, so what brought you? You know what? Let's get to the important things first. Are you single? Yes. You know what? My shoe size is 11. Well, how do I connect with patients? First, you start with a good pickup line, and then everything else follows suit.
So this is Mr. Tumor.
No dear, it's Mr. Neoplasm.
Yeah? No one cares. Anyway, so he looks like crap because he's got this huge ass tumor chewing on his spinal cord. It's gonna be a wicked surgical case. One wrong move and pow! Can I have in?
Sorry guys! I was in the derms department getting some lotion for my drying paws. Oh my god! Did you hear about Dr. Shepard and Dr. Gray? They got married on a sticky note!
Okay, well,
It's so cute!
back to patient guys. Mr. Neoplasm here is having difficulty in understanding the surgical case. So it's up to you guys to actually convince him to take the surgery, okay? I thought I'd throw in a little friendly competition to test their patient care skills. You know, to keep things new, fresh. The intern who best consoles their patient gets to scrub in the surgery. Genius, right?
So look, you've got a cancerous growth on your spine. So it's basically squishing everything. You're gonna lose your legs and stuff. Not pretty. It's ironic that cancer starts with can, because there's nothing we can do about it. Now just pulling your leg, we're gonna rip you open and pull out that bad boy. Easy.
Is there someone else I could talk to?
Hello! Had no idea what was under his nose. Stuck up. Here's another one for the morgue.
So Neo, personally, I don't think you need the surgery. Probably won't work. I tell you what will work. Herbal remedies. 2 pills. Red pill, you won't even remember you have cancer. Blue pill, 20 times a day, next 30 years, boom! 5% chance it'll vanish. Either way, both pills will do wonderful things for your libido with Trinity. Anyway, there's so many other options. You can lie on amethyst crystals, physiotherapy.
Now, Nelly. We're trying to convince our patient to do the surgery.
Herbal medicines, aromatherapy, physiotherapy, they do work, you know.
So I'm going for the visual approach. Fact, 78% of people comprehend better with a visual component. Fact, most interns kill 5 patients in their very first year. So I made sure I killed 5 patients on my very first day. Statistics don't lie. I'm going to explain this in layman's terms. This is you. This is your cancer. And it's getting bigger and bigger and bigger and bigger. And you look like a freaking black hole.
No, come on, don't worry now, Miss Button. So here's what's going to happen. You'll be put under anaesthetic, so you won't feel a thing. Once we're sure you're asleep, our skillfully trained surgeon will make an incision in your back where the tumour is. It's a tricky process and it'll take some time, and there are some risks involved, but we're going to do everything within our power to make sure you're alright. Is there anything you wanted to ask?
Well, will you be there to help operate, son?
What the hell? Tim!
What's wrong now?
He's put all my stuff in jello again. Now why would I do that? It wasn't funny the last 6 times you did it.
No, but really, why would you do that? There are people starving in deserts all around the world.
Dwayne, it's only a trifling matter. Don't make such a fuss.
Oh, I should be putting you into custody.
Good prank. So what do I think of Dwayne? Remind me again how he got through those .com modules.
Dickhead.
Boys will be boys. Now that they're out of picture, I'll just take your blood pressure. Could you just stretch out your... Oh my god! Your lifeline, it's so tiny.
Yeah, that's what she said.
Hey, Miss Kelly, I'd like to perform a physical exam on you. If you'd like to remove your clothes. Actually, you know, hold it for a second. I'll do it for you. Hey, Mike. I did a thorough physical exam on Candy, and I can indeed say she's a female, and she's hot.
And the diagnosis was...
That's right, man. She had syphilis. Like this. Syphil.
herpes.
Syphil.
Herpes?
Yeah.
But I actually don't think that disease actually exists. I think you need to try again.
That's cool, man. I made it up to describe it perfectly. I'm a modern day Shakespeare.
So after careful thought, consideration and analysis of you and your interaction with your patients, I have decided that Tim will be scrubbing on the surgery on Mr. Plasm. Well done.
Thank you.
Yay!
Mike, can I talk to you outside?
Alright.
Anyway, guess what I found on the weekend?
What?
Guess what? I found the most perfect nail file. Look at it. I don't even feel like I'm nailing my files. I feel like they're just magically going into shape. All I have to do is like,
Nailing your book.
yeah. Is that in your wallet?
So even though Mr. Plasm died on the table today, what have we all learned about patient care?
So what have I learned today? In our line of work, to get anywhere, you have to be willing to do anything.
I was right, you know, about his lifeline. So, obviously, there is some truth behind herbal medicine.
What? The issue isn't patient care at all. It's doctor care. I think Hippocrates said it best. Diagnose before you stick it.
Patient care? Well, I've learned how not to do it. That's usually the case with Mike and his interns.
Patient care? I don't give a about patient care. Screw caring for the patient and his tumor. Mike and his
I think Michelle has a touch of Tourette's.
Therapy!